Yes, hi everyone. We've run a couple of these sessions, so welcome. I am only having load shedding at 10 o'clock. I did check that beforehand, so my connection should be stable, and I think we've kicked into stage 4, so hopefully the rest of you will also be able to stay on the call. I have been involved with training of mid-level workers for many years, probably since around 2008, basic and post-basic, and then pharmacy technicians more recently. And then I also, you can turn off your camera, Lungile. Thank you. Sorry, can I just ask the office to mute anyone that comes in without their mic muted?
Will
Thanks.
do so, Dr. Fogarty.
Thank you.
I'm sorry for that. I just got back a dog. So okay, you can take over. Yes.
Thanks. Right. So, and I am a moderator for this exam. And so we are basically presenting to you today the information about the exam so that you can prepare yourself adequately to be able to write the exam. So what will happen is I will go through some slides. I will also give you an opportunity to ask questions, but there are 2 occasions during the presentation where I will ask you to scan a link, and I have prepared 10 sample questions for you to answer, and we will go through those questions and I will guide you through how questions get asked in the exam and what to look out for when you are answering a question. So it's a little bit of information about the exam and a little bit of a practice. And then once I'm done with my presentation, then the office themselves will take over from me. What I do want to just do is quickly change slides. Okay, there we go. Format and content of the examination is what I'll start with. What to do to prepare for the calculation questions. We'll do some examples of calculation questions. We'll then look at preparation for the general questions and some examples of general questions. And then the office will take over and take you through the remote online exam. So I'm now going to turn off my camera now that you've seen who I am and the voice, the face behind the voice. And we will now continue with the slides. Okay, so as far as, now why is it not changing? There we go. Right. So the format of the exam, for the basic, we say the EISA. Maybe you don't. Maybe I should even start with the EISA. I didn't do this in the previous session. Maybe I should start with what is EISA. We talk about taking the EISA, and all we know is that it's an exam. It's an external, integrated summative assessment. And what we mean by that is that it's run by Pharmacy Council as opposed to the provider of the qualification. Integrated means that it takes all your knowledge that you've learned through your programs in the workplace, etc., and it comes together, and the questions that are asked, they're asked in an integrated way, and it's summative assessment. So it's the final assessment for those of you that are doing the occupational certificate. It's the final assessment before you are awarded your qualification. And for those of you that are basic assistants wanting to transition into the new occupational certificate for post-basic assistants, this is that transition. You need to pass this exam to be able to transition into being able to register for the occupational certificate for post-basic assistants. Right, so this exam for the basic is 100 multiple choice questions. We talk about multiple choice questions. They are also referred to as single best answer questions. That means that there's a question and there are 4 options that you get to choose from, and only one of those options is 100% correct. We will talk a little bit more about how those are structured and what to look out for when you are reading a question and answering a question. The exam is 3 hours and 30 minutes, and you need to achieve a pass mark of 50%. And then a very important is that there is no negative marking. So you are encouraged to attempt all the questions. Even if you're not 100% sure, we still would encourage you to attempt the question, because you're not going to lose, you're not going to get minus marks for a question. You won't get a mark, but you won't get minus marks. Okay. So the exam, the 100 multiple choice questions, is split into 2 sections or 2 categories. One is calculation questions and the second is general questions. 16% of the paper are calculations, and so that translates to 16 questions. The significant thing that you need to know about the calculation section is that it has its own pass mark requirement. It requires you to get a sub-minimum of 60%. And then the general section is 84%, which is also 84 questions, and the sub-minimum there is to get 50%. Right. So the exam is also assessing a generalist assistant, okay? Particularly for those of you that are doing the occupational certificate, we are training generalists. That means that you are able to work in any one of 4 sectors: community, institutional, manufacturing, or wholesale pharmacy. And so the questions in the exam are related to exit level outcomes that are based on tasks to be performed by candidates in one of those 4 sectors. So what are those exit level outcomes? Well, there are 4 exit level outcomes. The first exit level outcome for the basic exam is that you need to be able to apply basic scientific knowledge to provide technical support in delivering pharmaceutical services. And we're going to look at each of these in more detail in terms of exactly what is required. The ELO 2 is to provide technical support for the receiving, storing, picking, packing, and distributing of orders, to perform stock counts and participate in stock taking, and those to be done in compliance with good practice standards. If we have to summarize ELO 2 into 2 words, we could say that the main focus of ELO 2 is stock management. The third ELO is to provide technical support for the manufacture, packaging, and repackaging of non-sterile medicines and scheduled substances in compliance with GMP guidelines. So let's summarize that one into a word, and we're going to summarize it into manufacturing. So ELO 1 is basic scientific knowledge, ELO 2, stock management, and ELO 3, we're looking at manufacturing. But these questions are about what a basic assistant can do, and therefore it is linked also to your scope of practice as a basic assistant. So manufacturing of non-sterile medicines. Then ELO 4 deals with the compounding, manipulation, and preparation of non-sterile medicines in compliance with good standards as well, and under the supervision of a pharmacist. So what is the exam based on? We've got those 4 ELOs, and this is how the exam is split. 40 questions, 40% of the paper will come from ELO 1, basic scientific principles. Okay, ELO 2 is 25%. We said ELO 2 was stock management. So 25 questions will come from stock management, 15 will be linked to manufacturing, and 20% or 20 questions will be linked to compounding. So looking at ELO 1 in more detail, what is an assistant, a basic assistant, expected to be able to do to meet the requirements of exit level outcome 1? Well, we expect that you're able to apply legislation related to the relevant scope of practice in pharmaceutical services in the South African context. That means you need to understand from a legislation point of view, you need to check and go and find out what the practice regulations say about a basic assistance scope of practice. Because sometimes when you're in practice, that some things happen in practice that are not linked to legislation. And so you've got to make sure that you know what is in the legislation itself. And then secondly, also a link to legislation and good practice is demonstrating ethical and professional conduct related to relevant scope of practice in the provision of pharmaceutical technical support services. So what are the ethical rules? What is the code of conduct? What can I do? What can't I do? How should I be practicing as a pharmacist assistant basic? The third ELO is to apply basic pharmaceutical terms and concepts concerning non-sterile drug delivery systems and their routes of administration. And so that is, what are the various dosage forms that are non-sterile and what are the routes of administration of those dosage forms? Okay, can everyone hear me clearly?
Yes, we can.
Okay, can you just respond in the chat to this person that's struggling to hear sound? Thank you. Right, and then the very last one is to apply basic scientific principles and perform basic scientific calculations. And just now when we get to the calculation section, I will explain a little bit more to you about what we mean by basic scientific principles and basic scientific calculations. Right, so then ELO 2, in a summary, was stock management. So everything in this ELO should relate to stock management. You need to be able to conduct distribution and control of stock of medicines and scheduled substances and medical devices according to standard operating procedures and good practice across manufacturing, practice, and wholesale and distribution. You need to be able to pick, pack, and secure orders for medicines or scheduled substances according to requirements and check that all orders are dispatched according to standard operating procedures. And then complete documentation. Okay, it's important to know what documentation is linked to stock management and how to complete that and what records are required. And then you need to know what it is to participate in a stock count and what might be required to be able to participate in a stock count. ELO 3, we said, was manufacturing. Within your scope of practice, that means involvement, assistance in non-sterile manufacturing. So applying good manufacturing principles and legislative requirements in manufacture, packaging, and repackaging of non-sterile medicines, organizing and preparing resources, materials, and equipment for the preparation of specific medicines, following relevant SOPs and process documentation, handling materials, considering the environment and storage conditions, as well as transport and security requirements, participating in manufacturing processes and packaging processes. And then again, documentation and records. And then ELO 4. ELO 4 is about compounding in a pharmacy. Also, we refer to it as extemporaneous compounding. But this ELO is a little bit extended outside of compounding as well. So it's applying GPP principles in terms of compounding of non-sterile medicines. You also need to know how to be able to compound a simple solution, a suspension, and a semi-solid, and complete records for those preparations. But then in addition to that, you need to know about checking and cleaning equipment according to SOPs, also performing various housekeeping activities according to SOPs, and then how to operate a personal computer to generate documents and spreadsheets. Right, so the actual exam questions. What types of questions do we ask? There is a spread of questions across knowledge, application, and problem solving. So we test knowledge. When we say we're testing knowledge, knowledge questions are about definitions. They are usually straightforward questions that you might be able to find in a textbook. What is manufacturing? What is a community pharmacy? Okay, just a very simple, straightforward knowledge question. A step up from a knowledge question is an application question. An application question considers the knowledge, but applied in a certain situation. Okay, so there will be a little bit more detail, or you'll be given a scenario, a little story, and then you've got to use the knowledge that you have and apply it to that story to be able to identify the correct answer, the single best answer. And then the third type of question that we ask is a problem-solving question. Now, a problem-solving question will also give you a scenario, but it will give you a few pieces of information, maybe 2 or 3 pieces of information that you've got to pull together and think about together, and then determine what the single best answer is, or the single best approach is in terms of the options that you've been given. So there is a little bit of evaluation of the information that you've been given. It's not just knowledge, and it's not just a single application. It's got more detail, more thinking around it, and some level of decision making. Okay, so now we get to the calculation question blueprint. How are the calculation questions distributed within the exam? So we said that there are 16 questions, and you can see that there's a big 50% of those questions, so 8 of the questions fall into ELO 4. ELO 4 being compounding. So 8 questions from compounding that are linked to calculations. And then between ELO 1 and ELO 2 are the other 8 questions. ELO 1 being basic scientific principles, and ELO 2 being stock management calculation questions. So here is more information on the types of questions you may be asked. For basic scientific principles, we generally are asking about basic conversions. How many grams in a milligram? How many liters is a milliliter? What is a percentage mass per volume? What is a percentage volume per volume? What is a ratio? Converting a decimal to a ratio. So anything that's very simple and not linked necessarily, or not necessarily applied in a scenario. Okay. Stock management. So stock management, then we're looking at stock consumption, reconciliation calculations in stock management, and then also looking at the cost of stock, or the value of stock. And that's something I think as a basic assistant, if you are working in practice, that you've done quite a lot of. And then ELO 4 is compounding, manipulation, and preparation. And so you will be, although it's done under supervision in practice, there needs to be an ability to do some of these calculations, calculating quantities of ingredients according to a formula to be able to prepare an extemporaneous formulation, and then reconciliation calculations in repackaging operations. And so when there is repackaging that happens, you're using a certain number of containers, you're using a certain number of tablets, you're using a certain number of labels. You then package from a bulk into a smaller pack, and there is leftover containers or maybe leftover tablets or leftover labels, and you've got to reconcile. How many did I take? How many did I use? How many do I have left over? That's what we mean by reconciliation calculations. And so there are some textbooks that are recommended for you to start preparing for your calculation section of the exam. We recommend a book called Pharmaceutical Calculations by H.C. Ansell. But remember that these calculation textbooks have got a lot of calculations in them, not just those for a basic assistant. And so you need to look at the sections that apply to you as a basic assistant in terms of the exam. Another textbook, Calculations for Pharmaceutical Practice, and the author there is A.J. Winfield. And then A.J. Winfield is an author also of a book called Pharmaceutical Practice, which is another recommended text. So, some calculation tips and advice. When you are learning for the exam and you are practicing calculations, because you must practice calculations, you can't just go into an exam and hope that you are going to pass based on your day-to-day knowledge. Calculations have to be practiced. You need to understand the principle. Don't try and memorize questions, okay? Or try and memorize, all the calculations are considered to be applied because you have to do something to get to an answer. It's not something that you just go and look up in a textbook, okay? So you need to understand the principle and apply the principle to the question. Even if it's a basic conversion, you still are applying a principle. This is very important. What are the SI units? Okay, what does it mean if we ask a gram versus if we ask what is a milligram, what is a milliliter, what is a liter? And then when you see these percentages, percentage weight per volume per volume, percentage mass per volume, what does that actually mean? And when we deal with percentage weight per volume, it always refers to grams. If you see 1% weight per volume, it means 1 gram in 100 milliliters. If you see 5% weight per volume, it means 5 grams in 100 mils. Okay. Right, so then the equipment. I know the slide says a scientific calculator, but at a basic level, you probably don't need a scientific calculator. Any calculator will do, provided you use the same calculator that you practice with in the exam. Okay, because you need to know how to use your calculator. You don't want to get to the exam and borrow a calculator, and now that the numbers are in a different place or the functions that you want to use are in a different place to what you used to. So whatever calculator you're going to use for your exam, make sure that when you're practicing, you use that same calculator and you practice with that same calculator. Make sure that you check the batteries before the exam. And know the various settings on your calculator, particularly if you are going to use a scientific calculator. And then we also say, make sure you've got paper and pen. And you're thinking, but I'm writing an online exam. Surely I just need my device. No, you need paper and pen because you need to do the calculation. Okay, you need to write down the calculation and work it out on paper so that you can then answer the correct answer on the online platform. So, calculation tips. I'm sure many of you recognize this kind of diagram, particularly if you've recently done your courses. And this shows us conversion, how to convert between units. In this diagram, we're doing weight or mass. So we've got micrograms being the smallest unit up to kilograms, which is the largest unit. Okay, and so if I've got 1 microgram and I want to work out how many milligrams is 1 microgram, I need to divide that 1 microgram by 1,000 because it's getting smaller. Okay, the microgram is smaller than a milligram, so I must divide it. So 1 microgram is equal to 0.001 milligrams. Okay. If I have 1 milligram and I want to convert it to grams, then I also need to divide. So 1 milligram to grams, I divide by 1,000, 0.001 grams. 1 milligram, 0.001 grams. What if I go from milligrams to kilograms? 1 milligram is how many kilograms? Now I have to divide by 1,000 twice. 1, 2. How many zeros? 1, 2, 3, 4, 5, 6. So now I put my decimal place. I have to move my decimal place 6 places. So from the 1, 1, 2, 3, 4, 5, 6. 0.0000001 kilograms. 1 milligram is 0.0000001 kilograms. Okay, so that's how this works. Okay, if I went from micrograms to kilograms, I would have to move my decimal place 9 places because there are 9 zeros. What if I want to know kilograms from a higher unit to a smaller unit? If I've got 1 kilogram, how many grams do I have? I've got more grams than I do kilograms. They equal 1 kilogram, but I want to convert it to grams. I must multiply by 1,000. So 1 becomes 1,000 grams. 1 kilogram becomes 1,000 grams. And the same if I'm going from grams to milligrams. 1 gram times 1,000 is 1,000 milligrams. If I have 1 kilogram and I want to know how many milligrams I've got, how many zeros must I add on? 3 plus 3, 6. Okay. And then 2 micrograms, another 1,000. And the same applies to volume. Microliters to milliliters to liters to kiloliters. If I'm going from a small unit to a large unit, I'm going to divide. If I'm going from a large unit to a smaller unit, I'm going to multiply. When you are doing your exam, read your question carefully and make sure that you are selecting the correct formula to be able to do the calculation, the correct concept, the correct principle, or the correct formula. Then you've got to work it out on a piece of paper next to you. You've got to be extra careful and double check yourself that what you have seen on the screen and what you've written down on your piece of paper are the same, because so many mistakes happen when we transcribe. That's what transcribing means. I'm seeing it on the screen and then I'm writing it on the piece of paper. And on the screen it says 50 and on the paper I write down 5. Do you think my answer is going to be correct? Doesn't matter if I do everything perfectly right, my answer is going to be wrong because I wrote down the wrong number on the piece of paper. So always check and double check your transcribing. Make sure you've used the correct figures in your formula. And sometimes as a double check, when you read the question, in your mind, you should be estimating an answer. Sometimes maybe you can even calculate everything in your mind, but estimate an answer. If I'm doing a conversion from grams to kilograms, am I expecting a big number or a decimal number? And if my end product or if my answer is completely different to the estimate I had in my mind, well, then I know I must double check myself because something's not quite right. Okay, so that's what we mean by, if possible, estimate a range for your answer in your mind. Okay, and then always double check your calculations. Do them twice. So as far as time is concerned, there's approximately 42 minutes to do the calculation questions. The whole exam is 3.5 hours, but we've estimated that for the 16 multiple choice questions, you will have about 42 minutes, which is approximately 2.6 minutes per question. Some of the calculation questions you might be able to do quickly, and others might take you a little bit longer. And so in total, you will have 42 minutes to complete those. Again, a reminder, no negative marking, so don't leave anything blank. If you get to an answer and you've checked it and you've double checked it and your answer is not listed there, still answer it. It's not a high possibility that there's a mistake because we go through such a rigorous process in setting these exams that it's not likely there's a mistake, but perhaps you've just made a small error, and so you can still try and answer the question. Okay, just talking about the exam process, there's various examiners that set different sections of the exam paper. There are moderators that moderate the exam paper. Then the examiners and the moderators sit and they go through all of the questions together as an exam panel, making sure that they're not ambiguous, that there's not two correct answers, that it's written clearly, that nobody will misunderstand the question. And so by the time you see the exam paper, it's gone through so many pairs of eyes that if there is a mistake, then it's about 20 pairs of eyes that have looked over it multiple times that haven't seen that mistake. Okay, so that's just to give you some confidence that what you are writing, because it's such a high stakes exam, it is a summative assessment, that you are getting the best quality exam that you can possibly get. Right, so the next slide has got a link on it. If you've got a smartphone that can scan this QR code, you can either type in the link into your browser or you can scan the code. And there are 10 calculation questions for you to answer. And then we will talk through each of those questions. Thank you. Ms. Malako has put a link into the chat as well, so you can click on that link and it will take you to forms. And I'm going to give you 10 minutes to go through those questions and try and answer them. There's 10 questions, 10 minutes, so that's only 1 minute per question. In the exam, you're going to have 2.6 minutes per question. So let's see how well you do, and then we will talk through each of them, and I will tell you what type of question they would be considered, so you know what to expect for the exam. Okay, off you go.
Sorry, Dr. T. We seem to be having hands. Takisha, how can we assist you?
Hi, sorry. I'm trying to go through the link, but I'm struggling to go on it. Is there any way that I can be able to go through the link to do the question or somehow, because I'm struggling to log in with it?
Did you use the link on the chat?
Yes, I am the link. So the one for the questions now that we are practicing at the moment.
Mm.
Yeah, that's the one that I'm struggling to log in with.
Can your phone scan a QR code?
At the moment, no, it's the only device I'm using. So I tried typing it in, but then it doesn't open. It gives me an error.
There are people on the in the forms answering, so might be your device.
Okay, thank you.
Okay.
Elisa? Elisa, how can we assist? You are muted. Okay, while Elisa is trying to find her mute button, Lillian, how can we assist? Lillian?
Hello.
Hi, yes, Lillian.
Yes, I'm having the same problem. I can't get into this link.
Okay. All right. But as Dr. T says that there are people answering, so the link is working. The challenge then might be with the phone. Keep trying.
Yes.
Yeah, there's still some time. All right.
Okay.
Okay.
Kamo, I think Wangiwe George is asking for some assistance. I don't think my response is satisfactory to her. Shall I just read what she's written, or do you want to speak, Wangiwe? You're welcome to speak.
Maybe what I will do, because I see the responses are quite a lot slower than they have been on the previous two workshops, I will go through the questions slowly and not show the correct answer so that people can try and answer it on their own. We won't see their responses, but at least they will know for themselves where they are at in terms of their knowledge.
That is accepted, Dr. T. Thanks.
Hi, Bezile. Please turn off your camera. Thank you. Mr. Bezile, your camera is on. Please turn it off.
May I please ask?
Yes, ma'am. Please do go ahead.
Sorry, if I can't get through, what happens? Because I'm trying to get through this link, it doesn't want to go.
We will be sharing the presentation after, so you will still have access to it and you can try it at your own time. Because right now the issue is the fact that other people are able to go through it. We're having around about 15 responses now, means that the link is working. So chances are maybe it's compatibility with your phone. So when you have it later, you will be able to maybe try it with a different device so that you can be able to practice. You will also have access to practice papers that you can then work with, and there's also going to be an opportunity for a practice exam. So practicing is not really a big issue that much. So just for you to be able to see the actual question, how they look, and then be able to attempt. So if we can't do it now, it's not going to be penalizing you in any way as far as this presentation is concerned. It was just going to be a better learning opportunity, but you will be able to still participate. I hope you covered. Thank you. Ntombenja, how can we help?
I'm also struggling with the link. I didn't go through. Now I'm worried. I think the 10 minutes is over. I wanted to check if there are any people who are not using the online thingy, the one that will use classes and stuff. Because we are really struggling here. We cannot go through and we are being left behind.
Okay, this isn't the exam platform. These are just some example questions. So what I will do is go through the questions slowly. I will take you through them slowly. So if you've got a piece of paper and a pen next to you, then you can write down your answers and then compare them to the responses that I give you. Okay, just so that if you feel like so that you don't feel like you're losing out.
Can we leave the group now? Then we can check it later because we are not doing anything right now at the moment.
You mean leave the link open? I can leave the link open, yes. But you'll have to copy the link down so that you can access the quiz later.
So, Ntombenja, do you mean leaving the presentation? Because we are about to get back to doing the examples and continuing with the other aspects.
Okay, I think the 10 minutes is over, so let me go through each of the questions. So those of you that weren't able to access the quiz, I want you to write down on a piece of paper next to you. I want you to convert 5 grams to milligrams. Yeah, are the 4 options that you've been given. Which option do you think is correct? Okay, you don't have to answer me, just write it down for your knowledge. Okay, you're not going to get a mark for this. It's just a sample to show you how we ask questions in the exam. Okay, so now what is the correct answer? We're going from a large to a small. So do we multiply or do we divide? From a large to a small, we must multiply by 1,000. So 5 times 1,000 is 5,000. So 5,000 is the correct answer. Okay, here's the second question. How many medicine measures is 30 ml of cough syrup? So for this question, you need to know how much is a normal medicine measure. A normal medicine measure is 5 milliliters. And so to work this out, you have to say 30 divided by 5, and the answer then is 6. The next example. What does 25% mass per volume mean? Now, I covered this under SI units when I was presenting the slides. Okay, so hopefully I've given you a chance to write it down. But we said that when you see a mass per volume or a weight per volume, it refers to grams per 100 mils. And so in this case, it's going to be 25 grams in 100 mils, which is this top answer over here. It's not milligrams, it's not 250 grams, it's also not 250 milligrams. What some of you have tried to do is convert grams to milligrams, but it would be 2,500 milligrams per 100 mil for this bottom one to be correct. Okay, next question. Those of you that were listening got this right. What is 50% of 16? Okay, 50% also is half of 100. So half of 100, half of 16, half of 16 is 8. Okay, some of you have doubled. A person weighed 70 kilograms at his previous doctor's visit. At his current visit, the patient lost 5% of his weight. How many kilograms has the patient lost? So between his previous visit and his current visit, he's lost 5% of his body weight. It's not asking what percentage has he lost. It's asking how many kilograms he has lost. Okay. So this is now a more problem-solving question maybe because you've got to do several steps. First, you've got to work out how much is 5% of 70. And that will then give you your answer here. One way you can do it, it's easier to work out 10%. So 10% of 70 is 7. And then because 5 is half of 10, you can then halve the 7 and you get 3.5 kilograms. Or you can do the long calculation and get 3.5 kilograms is the correct answer here. Okay, here's the next question. This is an example of how you need to be careful reading the question. And I've got a slide to show you how to work this one out. If 20 mils of alcohol are added to 40 milliliters of water, what is the ratio of alcohol to the total solution? Okay. If I say, what is the ratio of alcohol to water? What is the correct answer? You can write that in the chat if you want. What is the ratio of alcohol to water? Yes, that's correct. That is the ratio of alcohol to water. But what is the ratio of alcohol to total solution? First, you've got to add 20 to 40 and get 60. So your total solution is 60 mils. And then work out what is the ratio of alcohol to total solution. So that's 20 mils in 60 mils. And so the correct answer for this question is 1:3. You must read the question and make sure you are answering what the question is asking. I'm going to show you the slide with the solution on it. There. Okay, total volume is the volume of the alcohol plus the volume of the water. And so that means that the total volume is 60 mils, 20 plus 40. So then the ratio of alcohol to total solution is the volume of alcohol divided by the total volume, or 20 by 60. We simplify that 1/3, and a fraction is written as a ratio 1:3. Right, next question. During the packaging of a batch of medicine, 1,980 labels are used from 2,000 that were originally issued. What percentage of labels must be returned to the dispensary? Right. So this question is, again, maybe there are 2 steps that you need to follow here. So maybe it's a higher order level question. 2,000 were given to you to do your packaging. You used 1,980. So you had 20 labels left over. But the question isn't asking how many labels must you return to the dispensary. It's asking what the percentage of labels is. So those of you that answered 20, yes, it was 20 labels, but that is not a percentage of 2,000. You need to work out the percentage of 2,000. 20 divided by 2,000 is 1. So the correct answer for this one is 1. Oh, we got an even number of answers here for the 2. Okay, let's see, those of you that weren't able to answer the quiz. 50 containers of a medicine are counted during a cycle count. Of the 50 containers, 5 are expired, 2 are short dated, and 3 are damaged. How many containers of a medicine can still be issued? Okay, those of you that weren't able to answer, maybe you can also answer this in the chat, because we've got conflicting answers here. We've got 50, we've got an equal percentage of people saying 40 and an equal percentage of people saying 42. So let's see what you guys think. Okay, we've got another 40. 42, 42, 42. Okay, so those of you that said 42, that is the correct answer. What are we testing in this question? Yes, there's a calculation, but we're also testing your understanding of definitions. What is expired stock and what can I do with expired stock? What is short-dated stock and what do I do with short-dated stock? So we're testing stock management and we're testing a calculation here. Okay, now short-dated stock doesn't mean that it's expired, provided you don't dispense it within the month that it is dated. You can still dispense it. And the question is asking how many containers of medicine can still be issued. Okay, so in the immediate future, in the immediate now, I can still issue these 2 short-dated. So the only ones I can't issue are the expired meds and the damaged meds. So the 5 plus 3. So the 8 containers I cannot issue, which means that I can still issue 42. So the correct answer is 42. Okay, another question. Okay, what is the total value of 15 containers of a medicine that has a cost per unit of 130 Rand? Okay, some of you have multiplied and some of you have divided. So this is a type of question that maybe you're reading it as ambiguous, but you've got 15 containers and each container is 130 Rand. Okay. What is the total value of the 15 containers? Not how much is 1 unit. It's the total value. Okay, so 15 times 130, the correct answer is 1950. And the last question. Okay, this one might take a little bit longer to calculate. How many tubes of a 20-gram cream are required to be added to 80 grams of aqueous cream to make a 20% mass per mass compounded cream? Okay, Dorian says 1. Ngiwe says 4. Okay, we're not talking about 80 grams of aqueous cream. We're talking about your cream that contains the active ingredient. Okay, so maybe in a moderation session, we would have said, no, we need to be clearer here what we mean by 20 grams of cream. What cream? So 20 grams of the active ingredient, the cream containing the API. Okay, 1, Khomotso. Okay, so 1 is correct. I have this slide on a slide as well, just to show you. But if I made this quite simple to work out in that, remember we said mass per mass is grams per 100. So how many grams per 100 grams? So if I've got 20 grams and 80 grams, that is 100 grams. And so a 20% would be 20 grams in 100 grams. And so I need 1 tube, 1 20-gram tube to be able to make a 20% compounded cream. Okay, so those are the calculation questions for this evening. There's just another way of looking at it. Mass of the active ingredient over total mass of the cream times 100. 20 grams over 100 grams equals 0.2 times 100, which then gives me my 20%. Right, do you guys need a 5-minute breather? Give me a thumbs up. Okay. Okay. So there are a couple of thumbs up to say we want 5-minute break. I will see you then at 12 minutes past 7. Okay, are we back? I'm busy typing in a ratio question asked differently, because I think this is why you're going wrong. Okay. Timothy, you can turn off your camera. Thank you. Okay, so what I'm just going to type into the chat, a different way of asking the ratio question. If I give you a ratio of 1:2, and I say it's a ratio of alcohol is to water, and then I say there's 20 mils of alcohol in the solution, how much water is there? You will then be able to work out that there is 40 mils of water. If I ask you, given a ratio of 2:1 of alcohol is to water, what's the total volume? Then you will tell me it is 60 mils. Based on the same question, same properties. So again, there's 20 mils of alcohol, and the ratio is 2:1. Okay, so if that helps you understand the difference between the answer 1:3 versus asking that same ratio question a different way. Okay, I've put that into the chat for you. Right, let's carry on. So we're on to the general question blueprint now. The distribution of general questions according to ELOs. Remember, we said that there are 84 questions that are general questions. The bulk of those questions come from ELO 1, which is our basic scientific principles. And then the next biggest section is the stock management section, followed by the manufacturing section, and then the compounding section. Some books that you may use you are permitted to use books and PDF copies of resources or online references. But it is important that you make sure that whatever you're using is up to date and that it is applicable to the South African setting. Particularly for those of you that may have done your course a number of years ago, the material that you would have learned with your provider might not be the most updated. Legislation is changing all the time. Schedules of medicine are changing all the time. So it's important that you are using material that is the most updated and that is applicable to the South African context. Some references that we suggest that you use, there are PDF versions of the standard treatment guidelines and essential medicines lists, and that applies to primary healthcare, pediatric and hospital level. The Good Pharmacy Practice Manual and associated rules that you will find on the Pharmacy Council website under their publications tab. A guide to good manufacturing practice, that's on the SAPRA website. The Pharmacy Act Consolidated is also on the Pharmacy Council website, and then the Medicines and Related Substances Act is on the SAPRA website. There are online resources such as EM Guidance is a good reference source to use. If you don't have a PDF version of the EML, then there is an online guide. You can also access it via the EM Guidance link. And there's MSD manual as well that you can access online. So the important thing about using reference material, in the same way that we said that you shouldn't be using your calculator for the first time on the day of your exam, you shouldn't be accessing books and the information that is in those books. You shouldn't be looking at that for the first time during the exam. The exam is limited. You've got limited time. And so you need to have been through the work, understand the work, and if you're using a textbook or a document, you need to know what information is contained within that document. What information is in this document and how will it help me in terms of this question? What you should be doing is reading the question, thinking to yourself, okay, this I think is the right answer, but I'm not 100% sure. But let me go and check in this document, a specific document, and let that document then help you. Don't try and now start paging through the 10 documents on your desk to try and find a possibility of this answer. Okay, so sometimes people relax and they think, okay, it's an open book exam, it's going to be easy, I don't really need to study for it, I don't really need to be prepared for it. But then they get into the exam and they realize, oh dear, they're now going to run out of time because they're spending far too much time looking through the notes and trying to find the correct answers. Okay, so if you use the exit level outcomes as a guide, as well as those the breakdown of each exit level outcome and the detail that's contained in those as a guide in terms of preparation, and you go through the reference sources that have been recommended. You don't have to go and learn the EML or the STG, but you do need to know which STG to refer to and where to look possibly in the STG for some information to assist you in answering a question. Okay, so it's very important that you do prepare. Okay, don't just arrive at the exam thinking, I've got all my books, I'm okay, this will be easy. Okay, if you're using a book, make sure you know how to use the index of the book, and make sure that if you look at a document, you've got a little summary of what information you could find in that document or in that reference source. Okay, this is the reference source for my scope of practice. This is the reference source that tells me about the code of conduct. This is the reference source that I can refer to for stock management. Now, some people also think it's again about security, about having sufficient information, sufficient references. They collect as many reference sources as they can have. And instead of using 2 or 3 reference sources, they've got 20 reference sources on their desk while they're writing. It's not necessarily better to have more reference sources. Okay, in fact, it can cause more distress and more anxiety because you are now paging through a lot more books. Okay. And then we've already spoken about making sure that the information you are using is not outdated. There are also online references, and they can be downloaded before the exam. The office will assist you in where to find those on the platform. And you need to be familiar with what those online references are, okay, before you go into the exam. Right, and then also visit the South African Pharmacy Council website as well as the SAHPRA website. We don't limit our questions also to a specific reference source. So don't also fall into the trap of thinking, okay, it's fine, these are the recommended reference sources, so all the information must be in here. Okay, it's also about your practice environment. So we ask practical questions, skills-based questions that you are expected to know through your work-based learning experience. Right, so when you're writing the exam, make sure you read the questions carefully. Identify the statements of which you are sure. Okay, so eliminate incorrect statements and identify those you think could possibly be correct, and then only use your reference source to assist you. And then if you really are stuck on a question, don't waste time on it, move on, because at the end you can come back and answer questions that you've left out, But then we also encourage you to try and answer all the questions and not just leave them out. On this blue block over here, these are some of the wording we use when we ask a question. So we will say, which of the following statements is true? Or which of the following statements is correct? Okay, those are used looking for a true statement. The other statements in this in the options. So remember, you've always got 4 options. Only one is correct. So we're looking for the true statement or the correct statement. That means that the other 3 statements will be incorrect. If you see a question that says, which of the following or all of the following are true, except, okay, that is asking for a false answer. So we're asking for an incorrect answer. We're asking for the statement to be a false statement. Now we try and avoid these questions because they can be very confusing and very ambiguous. So we try as far as possible to only ask correct or true statements, but every now and again there is an incorrect or a false statement that gets asked. And so you are looking for the statement then that is incorrect. Out of the list of 4, which one is false or which one is incorrect. And then the other common way we ask questions is which of the following is most appropriate. And that implies that there could be, there's one very correct answer or most inclusive answer, and then one answer that could be partially correct. Again, we try and avoid partially correct, but it could be right, but I'm not sure. There will be an answer that is 100% inclusive, and that is the correct answer. Which one is the most appropriate? Okay, and then usually it's linked to a scenario. So go and reread the scenario and see all the facts that they've given you in that scenario. And that should then, the light bulb should go off and say, okay, I can see why this one is almost correct, but this statement here, that's the correct one, and this is why. Okay, in terms of this section of the paper, you have 168 minutes to write, 84 multiple choice questions, and approximately 2 minutes per question. Okay, you had slightly longer with the calculation questions. For the theory questions or the text general questions, you've got 2 minutes per question. Right, so here are 10 sample questions. You're not going to get a mark for it. It's just to help you see an idea of how the questions get asked. I'm going to give you an opportunity now to access the link. I won't give you 10 minutes because we are running short of time. I'll do maybe 5 minutes for those of you that can access the link. And then again, I'll go through it slowly so those that can't access the link can also have a chance to test their knowledge. Okay, thank you. If the office can just paste the link in the chat, thank you. Okay, I know that there's only a few of you that have completed the quiz, but I think in the interest of time, I'm going to go through these. Sorry, I just need to make the screen smaller so you can see the whole question. Right, so the question is, what is the most, here's that word most, correct term to use for stock that is at the end of its product life cycle and has not seen any sales or usage for a set period of time? Okay, so now if we look at the options that we've been given, unusable stock. Unusable stock is a term that can be used. It's not the term that's used or that is most correct. Okay, so perhaps during a moderation session, maybe we would do away with unusable stock because it's causing too much ambiguity. Okay, so I don't want to say that unusable stock is incorrect. I would just say it's not the most correct answer. Okay, damaged stock, no one answered that. Good. Expired stock. It doesn't say the expiry date. Okay, it's saying the product life cycle. In other words, it's no longer being used in practice. Doctors aren't prescribing it anymore, for example, or it's not being used in wound dressings anymore. It doesn't mean that it's expired. It's just not being used. So it's not expired stock. The correct answer, the most correct answer is obsolete stock. Okay, but another word for obsolete is unusable. But the point is that it's come to the end of its life cycle. It can still be used. And I think that's why unusable isn't the most correct term. So it can still be used. It just hasn't seen sales for a period of time. I would say damaged stock and expired stock fits better into unusable than obsolete. Okay, in this question, which of the following sectors is the first point of entry for patients seeking health services in the public sector? So this is about health systems and the structure of health systems. And as far as the structure of health systems and a health system working in an ideal way, the first point of contact is primary health care. Okay. This is a straightforward knowledge question, as is the first question. This is also straightforward knowledge, straightforward knowledge. Which of the following medicines can a pharmacist assistant assist in the manufacturing of? Now, the question sounds very much knowledge question, but if I start looking at the options, you can see that this is actually an applied question. And in fact, it might be bordering on a problem-solving question, because you've got to be able to read the question and look at the options and think, what are they asking me here? I'm testing your scope of practice in manufacturing, and I'm testing your knowledge of dosage forms. Okay, so there are two things that you've got to think about to be able to come to the right answer. So we said that the scope of practice of a pharmacist assistant basic in manufacturing is non-sterile, assist in non-sterile manufacturing. Then you've got to look at these different dosage forms and you've got to decide which one is non-sterile. Total parenteral nutrition, sterile. Subcutaneous injection, sterile. Eye drop, sterile. So the only one that is non-sterile is a suppository. And that's what makes suppository the correct answer. Okay. Which of the following tasks can a pharmacist assistant basic do in a community pharmacy? Okay, this is, I would say this is a knowledge question. The correct answer is capture stock into the inventory system. You cannot counsel a patient on how to take their medication. That is not within the scope of a basic assistant. Okay, or perform a blood glucose screening test. I hope you're not doing that in practice. Okay, What is a tablet that must first be dissolved in water before swallowing, known as? Again, a knowledge question asked a different way. So you've been given the definition and then you've got to link the correct term to it. Effervescent is the correct answer. Buccal goes into the inside of the cheek, and an oral disintegrating is just a tablet. It's not really anything. There isn't a thing called an oral disintegrating. Okay. I guess the closest thing to an oral disintegrating might be a buccal or a subcutaneous, sublingual. Okay, next. Where is the site of administration for a dosage form that uses transdermal delivery? Well, you need to know what transdermal means. So again, a knowledge question across the skin. So the site of administration would be the skin. Question 7, yeah, is a problem-solving question for you. Okay, so there are a couple of things that you need to consider for this question. You're receiving stock on the 30th of March 2024. It has an expiration date of the 30th of December 2024, and we're calling that new stock because we've just received it. But there is already stock on the shelf, and the expiration date of that stock is the 25th of January the 30th of January 2025. We're calling that current stock because it's already on the shelf. Using FEFO, how should the stock be packed on the shelf? So, number 1, you need to know what FEFO is. Okay. First expiry, first out. Well, what does the concept mean? It means that the one with the earlier expiry date must be issued first. So which one has the first expiry date? The newer stock has the first expiry date. So I must first issue the new stock before I issue the current stock. And so how must I pack that on the shelf? Well, the current stock must be behind the new stock. So the stock with the 30th of December is in the front and the 30th of January is behind that. Okay. Right. Oh, something went wrong. I don't know what went wrong. Okay. Maybe where are we? This one. Yeah. Okay, so for this one, you need to know what an amber bottle is. And an amber bottle is one of those brown bottles. Well, why would a tablet be in an amber bottle? It's to protect it from light. So the tablet is light sensitive, is the correct answer. It's not to say that tablets aren't sensitive to temperature or sensitive to humidity. We know that all medication must be protected from temperature and humidity, but in terms of the question, it's specifically asking about the amber bottle. And so the answer then refers to the amber bottle, which is the dark colored bottle, which means that this particular tablet is also sensitive to light. And so what is applicable to the question is tablet is sensitive to light. Okay, which computer program is most suitable for report writing? A word processor or Word document? Yes, these are all Microsoft Office programs. You might want to do a presentation in PowerPoint, do some calculations in Excel or a table in Excel, but the Word document is used for the actual report writing. Okay, and then the last question on the general section. What reference source can be consulted if a pharmacist assistant basic is unsure of what cleaning product to use when cleaning equipment in a community pharmacy? Glad you chose Good Pharmacy Practice and Standard Operating Procedures. Those are the correct documents, but which one is most correct? Good Pharmacy Practice will tell you that the equipment needs to be cleaned, but it doesn't necessarily specify what cleaning product to use. Whereas an SOP that is specific to the site that you're practicing at, that is what is more specific. Okay, so if you are working at a particular facility and you need to know exactly which cleaning product to use, the SOP must specify what that cleaning product is. Okay, so those are the general questions. I think I've already said most of this, so I'm just going to pick out a few of them. We've spoken about using the latest reference material, making sure it's the most up-to-date, making sure that you know your reference sources, that you familiarize yourself with those. Don't forget to use your work environment as a resource, okay? Both by looking up at your SOPs as well as asking for assistance from your colleagues and your supervising pharmacist. We've spoken about not trying to use reference sources you've never used before. Outdated course notes we've mentioned, and then also look at what's happening in the news. What are current events in terms of health and healthcare? NHI, there's always, at the moment, we hear a lot about national health insurance. We also, obviously during COVID, that was big news. Now we've got a bit of a cholera outbreak, so that's in the news. So stay up to date with what is happening in your communities and in the news. And then I think this is the last slide from me. Preparing for the exam. So once you know what the date of the exam is and the time of the exam, make sure you know where you're going to write the exam, and the office will speak to you a little bit more about that and choosing a suitable site to write the exam at, and determining what resources you need. What reference material do I need? Do I need a calculator? Do I have pen and paper? And get those things sorted out. Then work through those reference sources, work through those resources. Make sure you know how to use them. Make sure you know what information is in each of those reference sources. And then for the actual exam, what do I need to bring with me? Have a bag packed specifically for your exam. Even if you are writing at home, have an area where you've got all your exam things packed and ready for your exam. How long will the exam, how does the online exam work? And that's what council are going to speak to you about now. And how long is the exam? Okay, and so I'm going to hand over now to Taniko, and she's going to take you through the online exam platform. Thank you so much for being patient and for listening to me for so long.
Yes, thank you so very much, Doctor, for taking us through the content of the exam and the kind of questions that we should expect. And I hope we all enjoyed this session like I did. So I'm just going to take you through the remote online examination processes. I don't think we should be taking a break unless someone feels they are a bit pressed, because it's not long that we took, and I'm hoping this won't take as long as the other session. But if there's anything, you can indicate for me. So basically what I'm going to cover quickly about the remote exam is the eligibility, who is eligible to write the exam, how to book for this exam, how to prepare for it, where to find these exams when you are writing, you're about to write, and when you have found the platform to write the exam. So there was a question on the chat about who is to write this exam. I hope this slide will be able to answer that question. So whoever posed that question, listen carefully to what I'll be presenting right now. For people, who are the people that are eligible to write this EISA exam? So we have 3 categories of people that qualify to write this exam or should write the exam. First category of people is the pharmacist assistant that are currently registered for the new occupational certificate qualification, which started last year. So those people are, I believe, are amongst us. The second category, it will be the basic pharmacist assistant, current qualified basics. Those who are intending to do the new learner post-basic, the new current occupational qualification. Different, not the one that they did when they did the basic, which was the former or the current one that is being most people are being enrolled for. So yes, if you are doing your basic pharmacist assistant, you can write this exam. The third category is the students who have completed their first year of BPharm degree or who intend to register as pharmacist assistant basic. For those that are currently enrolled for the new occupational certificate, those learners must complete a minimum of 6 months of training with the accredited provider. So wherever they are studying, the course should take a minimum of 6 months. What the content of the course should be is that they should be able to successfully complete the knowledge module, practical and work experience modules. Those are the 3 modules that they have to successfully complete. They also need to have received, after completing the 3 modules, a statement of result from the provider or the institution they are registered with for this new qualification. They need to also, there is a practice exam which you need to write before you write the actual EISA exam. So it's a mini EISA exam. It's exactly the same. The questions will not be the same, but they will be so similar. There's the format and everything with the practice exam. So it's a way for you to practice so that you can be able to book for the actual, write the exam to familiarize yourself. So those are the 3 criteria that the learners, I mean the 4 criteria that the occupational certificate, new occupational pharmacist assistant basics need to fulfill before they can book for the online EISA. So the second category, it's those ones that I said are the ones that are already qualified as basics. Those ones, they need to be registered as qualified pharmacist assistant basics with Pharmacy Council. They need to have completed the practice exam, same as the one that I spoke about, and they then can book for the EISA exam. If you have booked for the exam, then you will be able to write the exam. The last category of people that can enroll for this as EISA exams are those that have done BPharm, the first years, who have completed first year. They should go to an approved pharmacy and work under a direct supervision of a pharmacist to complete 400 hours. And then the pharmacy should be able to complete for them the progress report when they have fulfilled the requirements which will be stipulated on the progress reports. So those reports must be filled. Then the same thing for them to complete the EISA exam, then book for the exam. So that is the categories of people who can write this EISA. How do you go about booking the exam? For you to book the exam, you need to go to the South African Pharmacy Council website. When you log on, you are going to log onto the site with your credentials, and then you will find on the dashboard, which means it's the first screen that you are going to come across. Here, where it's highlighted red, there is a pre-registration examination, which you need to click the tab for you to be able to book for this exam. When you click on that tab, it will navigate you to this page where it says examination bookings. It's what you are going to select in order to book. It will be for both EISA and for the practice and the actual EISA exam. The method of booking will be the same. When you are on that, it will navigate you again to the exam to this page where you need to book the venue. Under venue, you are going to get this tab wherein you need to do this. Click on the down arrow so that it can give you the options that you can choose from for the venue that you want to book the exam for. I'll take you through the important dates that you need to note down. I spoke about the practice exam. That is a prerequisite for you to write the EISA exam. So the practice exam will be on the 18th of March, 2024. So you need to book for this exam and write, if you are intending to write the exam, which will be on the 27th of March, 2024. So the exams will be a replicate of each other, the calculation part and the general part, which Dr. took us through. Before you can embark on the exam, please ensure that you update your South African pharmacy profile. Your cell phone number should be the most recent cell phone number that you are using, that you will be able to access, even the email that you use, because if you are having an old or a number that or email that you're not having access, the response will be sent to that cell phone number in the email. And you need to note that the exam is only written online. As we have said, it's remote online exams. You also need to ensure that you take a new profile picture, which is not that old, recent, which will the invigilators will be able to see that it's the right person that is writing this exam. So the bookings, once it's done, you're going to receive an SMS through your email, as well as you're going to get a message through your email as well as the SMS. These are the 4 options that you have when you are choosing a venue. You can either choose to write your exams at home, in a place of residence, or at your workplace, or another option is for you to come to the office of the council, South African Farmers Council, or any other venue that may not have been listed above. Then you can choose if it's not any of these that I've listed here. But the venue needs to be a venue that will give you privacy and you'll not be disrupted by noise and other things, where you'll have enough space to write. So for you choose these venues. There's something that I need to highlight to you is that whichever venue you choose, if you choose to write at home, it means liability of you not having access to internet, your laptop not working lies with you, or at work. So you are taking responsibility that your gadget is working and everything is okay. Therefore, every liability in relation to that will be with you, except if the fault is from SAPC. Then it will be something that will be communicated to everyone. But under general, you need to choose wisely the venue that you choose. If you don't have a laptop or anything, please ensure that you choose in the office, because that will be provided. For the remote examination, you need to choose a venue which is quiet and suitable. You need to have enough space where you can move around. I mean, you can have enough space to put your reference book, your laptop, and the phone, and any other things, a notebook that you're going to be using. So that should be looked into when you're choosing the place that you're going to write the exam on. If you're going to write the exam and you need reference books which are online, ensure that you download those books before you go and write exams, because you are going to waste your time trying to download books while you are writing exams, and that time will never be recovered. So please ensure that all your documents and your references that you want to use for exam, they are there before the exam date. When you are busy with the exams, because it's something fairly new to you guys, and it's a new process, we're using a program called Proctor. So you need to calm down. If you see something that you don't understand, you will be having an invigilator that is assigned to you. So as soon as you are logged in, they will be communicating with you. So whatever challenge you have, you will communicate with them, and they will communicate with you. So there are people assigned. So keep calm and ensure that you communicate your challenge to us. Ensure that you have the relevant equipment. You have all your calculators, papers, and everything that you need to have, because for you to move out of the screen for a long time as well, the Proctor system is going to detect that you are not there for a long time, which might be a violation, which we'll get back to as we're going along. Now, there are two devices that you need to have when you are writing the exam. You need to have your laptop with you, as well as a cell phone or a tablet. You can use a tablet as the second device. So ensure that when you are writing the exam, you have those devices and you have connection to internet, wherein you will be expected to have a minimum of around 3 gig of data that you're going to use. Although the actual writing of the exam, it's not going to come from that 3 gig. It's mainly for you to have connectivity to start, or when you're kicked out of the system, for you to be able to restart again. So ensure that you have data or have access to Wi-Fi on that day. You also ensure that your devices have both a camera, which will be able to take, because whatever it's taking, the pictures it's taking, the invigilators will be seeing all the pictures of you from the beginning of the exam until the end. So the minute one of the cameras from your phone or your laptop is not working, it's going to detect that as a fault, and it's going to count against you. So ensure that it's working properly. There are 3 main browsers that we prefer that you should have. Ensure that you download them before the start of the exam, not during the exam time. Google Chrome, you can use Firefox, and Microsoft Edge. Those are the compatible browsers that we prefer that you use, which we know that won't give you a problem. Please ensure you download those browsers. So when you are taking the profile picture to upload on the SAPC website, we are requiring that you take a color image, not a black and white picture. It needs to be a picture of you in color. And I've already highlighted that mustn't be more than 6 months old, and you take it from head up to your shoulder. So don't cut part of your head. It needs to be a full picture of your head. We need to see everything. So where do you find the exams? You need to log on to the SAPC profile. You put in your login details, that your current login details. The minute you are logged in, you'll choose a registered person, and then on the web page you go to learner. This is the one highlighted in red. That's where you choose where to find the examination on the day of the exam. So when you have selected that, it will take you to this page of the learner. There, you are going to see these tabs that are up here. You are going to select the one that says assessment. That is where you are going to find the tab for you to book the exam. So you will click on the blue highlighted area for you to have access to the exam. So on the day of the exam for the EISA, as it has already been highlighted, it's going to be 3.5 hours exam that you'll be writing. But please note that our actual exam is going to start at 9 o'clock. But you need to start logging in on an hour before. The reason why you need to log in an hour before is because there are few logistical things that you need to pass before you reach the exam venue. So when you log on to the website, as I've shown you above, you are going to receive an OTP number on your email as well as your cell phone. That is why I said it's important that you update that cell number and the email address. So this OTP number, it's what you need for you to have access to the platform. After getting that access, you will have to fill in, complete a declaration, which my colleague is going to show you in details, but I'm also going to explain to you what is on the declaration. Read the examination rules. So this is enough time within an hour for you to be able to make sure that you are logged in, all your queries are addressed before the exam starts. Because when the minute the exam starts, it will not, your time will not be compensated if you have other challenges. So you will go through the examination from the time the chief invigilator starts the exam, and images of you will be taken all throughout until the end of the exam. When you have completed the exam at 12:30, whether you have submitted or not, your exam will be closed for you. Whatever you have not answered will not be answered, but whatever you have answered will be saved and will be able to access. On the examination platform, there are steps. The reason I told you need an hour at least to work around. These are the steps that you need to follow, starting by your logins, which are similar to the logins that you use when you are logging in into the website. Then you go there where you get the OTP sent to you. Remember, I said you will receive the OTP on your cell phone as well as the email. Then it will take you to the proctor. Then you do the annual the declaration. They are going to take you through a few steps, which I'll read to you later, what you need to declare. After doing the declaration, you are going to start the exam. It will indicate to you how long the paper is, starting from what time to what time, how many questions are there, and what is the overall pass. So when you are there, you will click start the exam. Immediately, it will take you to starting the exam. So the questions will come randomized. You are expected to write the exam alone, not with other colleagues, not with anyone. So the questions are randomized. Even if you have a colleague in the same sector and you were to discuss question 1, you will find your question 1 is not the same as the other person's question 1s because they come in a random manner. There will be the same number of questions, but the way they will be coming, you might do question 10 while somebody is doing question 2 as the first question. So this is how the question is going to be. Where it's written question, that's where the question will be. And then the options with the answers. So you choose the most appropriate answer by clicking on. The one that you click on will be blue. So after completing all the questions, you will have to also do a declaration again at the end of the exam, wherein you're declaring that you are the one who completed the exam without assistance from any person and you had adhered to the code of conduct. You understand that if you are found to have contravened the code of conduct, SAPC might have to discipline you. And then you also declare again that you will not share or retain the content of the examination via electronic, printed, written, or verbal means with any person. When you are agreeing to these two declarations, then you submit. So without you agreeing, you will not be able to move to the last step. So now examination will be complete. Then you can go to do the post-examination survey, wherein you're going to rate the exam. Steps for logging in to access the examination platform on the website. As I've already highlighted to you where you are going to find the exams when you are logged in here, that you're going to assessment. This is where it will take you. There is also a link that you can use alternatively, which is this link here, that you can access the exam by clicking on the link. It will navigate you straight to here. So you have these two options on your Chrome or Firefox or Microsoft Edge. Then, as I've already highlighted, you log in to SAPC, and then the OTP is sent to you. So there's something that you need to also note in terms of the OTP. The OTP will be sent as an SMS to your cell phone and through the email, and it's valid for 10 minutes. So even if you want to request for another one, it will not send you the new OTP before the 10 minutes has elapsed. So if the OTP was not used and you want to get a new OTP, maybe your number was not working, was not the correct number, and then that was fixed or something, you will need to wait for that 10 minutes. Hence the issue of the time, you starting earlier. Then it will generate a new one after that 10 minutes. Equipment check. So when you have put in the OTP, so please note some of these things that I'm saying, it's a repetition because I'm going deep into details of the whole process. So when you have logged into the exam, the first thing that the system is going to do, it's going to check the equipment that you have. Remember, I said your laptop must have a camera. You must be on a right browse. It must have a microphone so that we can pick up the noises that are around you. So whatever is happening when you're writing the exam, the invigilator is able to hear. Whatever you speak, if there's any noise, even if it's a bird singing, the invigilator will be able to pick that, whatever is happening. And also the proctor it writes a report to say there was noise, so much noise coming from this. If it's excessive, it will make it a violation, meaning you violated the rules of the examination. That's why you need to be in a quiet place. Network checks, if you're not connected to network. So the minute you are on this, it will start ticking. You see the first browse, it checks for you the browsers, it checks for you the camera and all that. When all is well, it will all be green. So you wait a little bit for it to go through them all. And then if all this is green, you press next. You go to the next step. Then when you have logged into the profile, you can put your name and your first name, your last name and your first name. The middle name is not necessary. You can just put those two if you don't have a middle name, because the middle name is not compulsory for those who don't have. So sometimes this might be it might come up automatically, but if not, please ensure that you fill in. Immediately you do that, the system, the Proctor system is going to verify your picture. It wants you to take a snapshot of your picture so that it can save that today. You cannot start as somebody else in the middle. We see a different picture. So the one that you take when you start must be the same picture that the invigilators are going to see throughout, because this is being recorded. You do that, you take the picture. If you're not happy with the picture, you press retry here. It will take another one but take note of time, that you don't waste time trying to take a beautiful picture. As long as it's clear and visible, there's light enough to show a clear picture of you. Then you press next when you're satisfied with the picture. Sorry, I don't know what happened there. Sorry, I got something happened to my system. Let me quickly share again my screen. So remember, I said to you, I'll take you through the declarations that you need to declare before you write the exam, those things that you had to tick, and then for them to be blue or gray before you go to the next step. That you are completing the exam in a suitable area with a minimum anticipated distraction. Pardon?
Have we lost sound?
Oh, I'm sorry for that. Thank you, Doc. I don't know how far I was, but okay, anyway, there are a few things that you need to declare before you write the exams. It's that you are not going to get assistance from anyone. You have procured enough data. You're not going to receive assistance from other persons. You're not going to communicate with anyone who is close by. You're going to only use the reference materials that is permitted. You're not going to go to Google, because you're not allowed to Google the answers. So if you go to Google while you're writing the exam, your invigilator will see that, and it is a violation. So please don't do that. You can use your material that is on the screen, but not to Google the answer. not give any assistance to any person completing this exam, not share or retain the content of the exam via electronic, printed, written, or verbal means to anyone. I would inform the South African Farmers Council if I am aware of any candidate that contravene the examination code of conduct. So these are the things you need to declare before you write the exam. You remember I took you through the end declaration. The other one that we were doing now is the one that you start with. This is the one that you do at the end of the exam. So it's important to read the instructions, the exam instructions. The questions are going to start immediately at 9 o'clock, not at 8 o'clock, 9 o'clock when the exam starts. It will pop up for you to start. So the format of the exam, I've highlighted that it's one question per page. So you'll not be able to see many questions at a time. It will be one page, and they are randomized. I've explained that your first question, it will be somebody else's 10th question. The exam is timed. So if it's 3 hours, 30 minutes, within that, it will close. Cannot revisit any question that has been answered. So if you are not sure about the question, don't answer until you are satisfied. You can go to the next one. You can come back to that question that you were not sure about the answer. So, but you, once it's answered, you cannot go back to it and redo it. So you choose the best answer from the options that are there. Because some things might look familiar, but you have to choose what is best. I won't re-emphasize this because we have already been taken on in about the content of the exam. The only thing that you still need to remember that your answer, you click on one. There will always be 4 options that you must choose from. You choose by clicking on it, like I'm doing right now. Then it will be grayed out. So the violation during exams, I did speak about a few things already. And there can be action taken against candidates. Ne? If you are cheating, if you are seen cheating or copying or being in a position of unauthorized material, you will be taken to task for that. So you don't go to Google for that. So ensure there's no noises around you. If there's anything, communicate to the invigilator on the chat box. There will be a chat box where you'll be able to speak. Where can I get help? So I said on the exam platform, when you have opened the exam, there is a chat function where you can type in the questions or the queries or any concern that you have. Please type, there will be somebody who's on the other side to respond to you. Or else, if you cannot get help through that, you can also find that your invigilator has a WhatsApp that they're communicating with you. You can also use that. Please try to keep calm at all time, as the invigilators, maybe the time you send the message might be busy with someone else. Few minutes after, they will surely attend to you. Keep your cell phone next to you to ensure that it needs to be fully charged. The laptop as well needs to be charged. You cannot run out of battery. It will not work to your advantage at all. Make sure that you have the data that we're requesting or access to Wi-Fi. And if the invigilator is seeing a violation from you, from time to time. Maybe they sensing noise or they've seen somebody passing behind you. They will inform you and they'll communicate to you to say, you are violating this and that examination rule. So please refrain. So immediately respond, don't ignore. What do you, when you lose connectivity, keep calm. But you need to know that before you choose the venue that you're going to ride in, you need to know the schedule of your load shedding. If it's not, there's going to be no electricity at any given point, choose an alternative place. And I've already said you must ensure that your laptop is charged and the Wi-Fi story. I will not repeat that. So when you are going along, if it happens that maybe electricity, the power is off, you want to move from maybe your Wi-Fi to another alternative, or your laptop, you need to switch because maybe this one is giving you a problem, you need to switch to the other one. Please be rest assured that your work that is done up to that point is saved. So you'll be continuing from the question. If you have done 10 questions, it will not be like you're starting from scratch. It will be a continuation. So you can, sometimes if you have challenges with the current browser that you are in, we advise that you log out, you try as quickly as possible to log on to a different browser. Maybe Microsoft Edge is giving you a problem, quickly move to Chrome quickly so that you don't waste any time. So where you sit is very important. You cannot sit in a place where maybe there's a glass window, people keep passing there, smiling at you and seeing that, because the camera is going to capture those faces and it will be like there's more than one person in the place. Ensure that there's light. You cannot ride in a place that is dark where we cannot be able to see your face and all that. Ensure that the camera is on at all times, both cameras, the one on the laptop and the cell phone. And please dress properly. We're pleading with you. You cannot have a topless exam writing session. You need to dress properly like you are a professional. You need to be aware that the exam results will be released after they have been analyzed and verified. And this may take some time. So please be patient. As soon as the results are out, they will be sent to everyone. And if there's anything different, it will be communicated. You are allowed to review the examination if you feel that maybe there's something, but you need to be aware that this is get analyzed and verified. And since this is an electronic exam, it's electronically marked, but still it gets checked and double checked. So, but if you still feel that there's something that you need to come and check, you will be allowed, but there's, I think, a fee that is attached to it. You can come and review the exam and check and satisfy yourself. You may not apply. You may not apply for marking, like I've already indicated that this is electronically marked and they are verified and checked. Before I come to the questions, I would love to hand over to my colleagues, my colleague who will navigate you through that Proctor system that I was showing you, how it looks like in real life, so that you see how you're going to navigate. So it's just to emphasize what I've been showing you. Over to you, Memlalo.
Okay,
Good afternoon, colleagues. I will then just display, and I'm hoping I'm audible. All right, so I am going to display and proceed with a demonstration. I'd like to believe that I can safely ignore the hand that has been raised so that I can focus, and believing that we'll take questions after this session. So you would then go onto the website. The website of choice is the SAPC website. As you were shown, you are a registered person, and you would then go to the tab Learner, and you look for assessment so that you can access the link that would have been provided for the practice exam or the examination, as the case may apply. You click on it. And you remain calm. With enough time, you are able to log in successfully. Look at that. I almost got a heart attack, which is pretty much going to be the case with you guys as well. So you stay calm, but you afford yourself enough time. Right. And then you put in your details. I am going to not have an advantage and have populated information. So I'll start from scratch because I'm encouraging individuals knowing their own details. Oh, this is going to be tricky. All right, something is not right over there. And then I need to fix this. Right, so I like to demonstrate a real life circumstance, which is in this case, if you don't have the correct login details as you were told to update, and if you have not noted them down, it will then waste your time and make the examination a very unbearable experience. So at this point, I'm expecting to receive my OTP, which has come through, and only I can see it on my phone, and I'm not sharing it with anyone. If I don't see it as a text, I will then see it on it will then have been sent through on my email. I type it in. And then I ask to continue with the examination. Let me make this window bigger. And then voila, we are in. Step 1 of 5. It's important to keep your eyes open, keep your attention focused on the screen, no distractions, so that this is a success. This is allowing me to continue because it says next and it's in green. I like using the scenario of the robot or traffic light system in South Africa because there can only be 3 colors to guide you. Green, we go. So number 1, it is trying to ask itself, this is the system now, compatibility. Does my browser check get a tick? The browsers that we're referring to is the 3, any one of the 3 that was being referred to. And it is compatible because I've done the testing. I'm ready. I've done the compatibility to ensure that does not become a stumbling block. It proceeds on its own. And there's an interruption. It's real life. This interruption is because I have 2 screens. I've got my computer and I've got a second screen. I know that I have that, but I need to read to say what is going on now because they never said this would happen. Choose what to share with exams.sapc.za.org. This site will be able to see the contents of your screen. I then need to say, I'm going to share the entire screen. I am obliged to share the entire screen for the purposes of logging in and writing the examination. I will click that I want to share, and I'm going to say, please share any one of the screens. But let me tell you that pop-up is going to come back again, because you see this little orange, is it amber? It's telling me a problem is coming, and I'm waiting for the problem to be evident in my eyes, and I see that, oopsie, it's saying to me, screen check did not pass. But I can physically see what I've done with my computer that nobody else can see. Magic. I'm going to pull out the second screen that is being referred to, and I'm going to ask to be given an opportunity to retry, so that I can show them that I only have one screen. I don't have any other screen that I'm looking at, which could suggest that I'm getting information that I'm not supposed to get throughout my examination, which is a violation. So let's see if Amber is going to become green like the other bullets on top, and voila, it turns green. Right, it then continues with its system checks that cannot be argued or disputed. If it doesn't turn green, it means it is not compatible, and it immediately becomes a stumbling block, which speaks to lack of preparedness towards the examination. Right, I am at step 2 of 5, but I'm allowed to continue because green, I'm good to go. So when I logged in and having forgotten my password, not knowing my ID number, and all that mixed bag of things that were happening, the system should be able to recognize you, because this is SAP's platform, and you're going to only log in if you are a registered person, and therefore it should ideally recognize. It may not know your middle name, but in my case, I do not have. So I'm going to go step 3 of 5, and I then continue next. Now, this is the most interesting part. She did indicate that you'd need to take a picture. Look, I like beautiful pictures, so I'm photo ready. So I'm here and I will take my picture, but I need to make sure that my face is in the oval shape so that it does not give me grief. The instruction is over there, and if I complete this, I would have completed step 4 or 5. I'm going to now take a picture. It goes green. It says you can retake the picture if you don't like, but I mean, if you've got time, you can do that, but I just really want to get to the exam. So I click next. And then it tells me the QR code that Dr. Fogarty was referring to, it comes back all the time. So this speaks to having an Android or Apple phone, because those are compatible. And you need to make sure that if you don't have, you can borrow for the purposes of the exam, because otherwise this is another yet a stumbling block. So I am going to use my phone, and I am going to scan this QR code. And from this point, I am going to turn on the camera of this, just closing my window there. I'm turning on the camera. I hope you can see me, because I want to display what the phone is asking me. It might not be very legible or clear to your screen, but the phone is now talking to me, and the screen on the computer is not talking. What the phone is asking me is, it says, please play icon to turn on the camera. Before this happens, it would have said to me, SAPC exams wants permission to access your cell phone. I know who SAPC is, so I allow them. In this case, I am going to, this is the message that I was talking about. Oh, let's hope you can see that. It's a little pop-up. I hope you can see. It says, test SAPC Proctoring app, would like to access the camera, microphone, and on your phone. Do you allow or cancel? Of course, you want to get to the exam, so you allow. After allowing that, I'm going to display here now. It then says, and I'm reading each word. I'm not assuming I know what it's asking, because this becomes a very big problem, because we click or don't click, but the message is written. So it says, record a short video showcasing your workspace. Then I start. This is about a minute recording, which I then need to do, and I would be recording as you can see, my surroundings, because somebody needs to determine compatibility and suitability for this exam. I've got a table, I have a computer. I don't have anyone in the area that does not need to be here. And this is the case whether you're writing at the SAPC offices or you are writing in your own comfortable home, workplace, or other venues. As the venues are listed, you are required to do the same. So I've got about 20 seconds to go. And at this point, I'm not sure what I should be doing other than retaking the video again. The reason why you take it up until you fulfill the requirements of the recording is because if you interrupt it, it is exactly that you've interrupted it. You will not progress to the next step, and it will cause volumes and loads of frustration on your side. It has now told me that I can save the recording and the color changes to blue, which is next to green and it's not red. So I then save that video. It asks me, save the video, yes or no. You might think you don't like the video, whatever the case, if you've got time, you can say no. But I choose to say yes. And after choosing to say yes, I can tell you that it's uploading wherever this is going. And then it gives me a green light. I like the color green. I should have been wearing green today. It says the camera is connected successfully. Go back to the computer. That's a very clear instruction. But I am going to now stop the camera and then we go back to the screen. You see, this is one and the same platform. It's integrated. So it tells me I can now proceed. Remember, I couldn't proceed because I needed to do the QR code. Now everything is green on my phone, and voila, step of 5, I can almost start rejoicing. I'm landing on the exam pages soon. I click next. Right? Then I read, everything is ready. I am so happy. Now you can start the event. The event for today would be the external integrated summative assessment for the basic. It's green. I can then start. As soon as I start, this keeps coming back because it wants to ensure that at no point is any candidate having more than one required screen. I want to explain this little picture that you can see here, that the invigilator, as Tinyiko mentioned, should ideally keep seeing you throughout the entire examination. If you can't be seen, if you can't see your background, there is a problem. So I then need to always say, I want to the entire screen to be shared. I click on there and I click on that screen that I deem necessary to be shared, and then I share the screen, and then voila, I've landed on the declaration. A little bit of an unfair advantage here. It shouldn't have been ticked, but because we do a lot of testing, it thinks I have been here and I just got here now. So I would ideally then read each line. I've got enough time to do that. I'm not just clicking away, because then you are not sure what you're committing yourself to, right? So you click this one by one. I'm going to hide this. I'm going to click, because we read with Tinyiko as she was going through her presentation. So we're not going to waste time and be reading all these things. That will be at each exam for you to read all the time. And then once I'm satisfied, one by one, from the top to the bottom, then I continue. Right. After continuing now, I can almost guarantee you that I'm on the paper. But again, it keeps coming to say, share the screen, and I do that. I do not tire, because this is compliance and continuous monitoring all the way through. So then I wait here, and there will be all this information that you're happy to read. It's about time allowed, 3 hours, all the details that you can gladly go through. You see all the information that was presented to you in terms of the composition, the duration of the examination, who your examiners are. It was moderated, that was mentioned to you. The instructions of the examination you go through. You wait and you keep hovering on this page, hovering because if we use banking apps, would know if you spend time away after opening a site, it then slips because no one is there. So it would probably do the same. So you keep hovering and hovering, and at the appropriate time, which is usually 9 o'clock, 9 a.m., the officiating officer, who would be the chief invigilator for that examination, then officially starts the examination. Then you have access to this start the examination. I think I'll pause here.